With healthcare costs increasing, as they have in the United States for many years, with healthcare consuming 18% of gross domestic product, we should see tremendous return on that investment as a society. But our health indicators are no better than Western countries who spend half as much per person as we do. So we have to learn lessons from how others do it and then create our own uniquely American version of how we care for the folks in our country. I'm Stephen Blumberg, and I'm Senior Vice President and Executive Director for AtlantiCare Health Solutions, which is our accountable care organization. Accountable care is the transformation of healthcare from a volume-based endeavor to a value-based endeavor. It's very critical as we look forward into the kind of the new healthcare world that we think about paying for value instead of just for volume. Healthcare providers have always been paid in our country on productivity. They do something, they get paid to do that thing. There is a substantial shift in thinking on that across the industry. And payment for value, in other words, did you produce a result, which mimics how we treat almost every other economic transaction in our society. That's coming to healthcare now. The Special Care Center for us was the beginning of that. The SCC was originally developed in partnership with a local union who represents workers at the casinos, which is the largest industry in Atlantic City. The union was very concerned about both soaring healthcare costs and the care of their most chronically ill patients. And we worked together to develop a program to address both those needs.
I knew intuitively that it would be a success, but it was not a proven concept. So because I'm a nurse by background, it just felt like if you did it right, you would get the outcomes you set out to do. My name's Margaret Belfield, and I'm the Chief Operating Officer for the AtlantiCare Regional Medical Center. In healthcare, there's 20% of the patients who cost 80% of the dollar from the employers who pay for the health insurance. So it was really important to figure out how to get that cost down and keep them out of the hospital and keep them healthier and living longer.
We've taken the traditional payment methodology of how a patient is seen in the primary care office and then a payment is received for that patient being seen, and we've turned it over, flipped it on its head and basically said, we need patients to have full access, as much access as possible, because they're chronic, they're costly, and they're complex. And if we can get them seen regularly and work in partnership with them, then we can really reduce their expense and improve their quality of life. So that's the premise. One of the things that was really important and novel about the approach was for economic barriers to be removed for the patients. They're already chronic, they're already ill, and putting the ordinary disincentives in place like co-pays would make no sense going forward. And so from the patient's perspective, once they're invited to join this model, for the most part, their cost for primary care goes away. So the employer or the funder, whether it's a union or an employer, they agree to pay a per member per month fee to cover the cost of care at the Special Care Center. The patient's premium for their health insurance would be collected as it ordinarily has been, but the money that they would ordinarily pay at the time of service, that's the part that is taken out of the equation, along with co-payments for their medications as well. That co-pay goes away as well. So there's two primary ways that patients are identified and invited to join the SCC. One is by physician referral, and then the other way is through a mathematical algorithm where they're risk stratified by looking at the history of their claims. The SCC's tools and techniques have proven themselves very successful, and we've now been able to export those tools to the rest of our primary care network. Let me talk about AtlantiCare as an employer. AtlantiCare as an employer 3 years ago saw healthcare costs increasing at 12% a year. And because we've implemented both the techniques we've learned at the Special Care Center as well as engagement techniques. AtlantiCare's own employee healthcare costs have gone from an increase of 12% to now a net decrease of 3.9%, because so much of the spend that they incur throughout the year is on a narrow group of people who consume a lot of resources. And putting the attention and energy into that population really flattens the cost curve.
The Special Care Center improves quality outcomes and it decreases the cost of health care, and that's so needed in this country.
And now that we're moving into accountable care, we have so many great lessons from the Special Care Center that we're able to export to the rest of our patient base. I think it's very easy for current leaders in our industry to think about things that are right in front of them, and they're very much oriented towards kind of the old model. And I think it's incumbent upon leaders in our industry to stop, back up, and think about the real value proposition that we can make to people who are paying the bills, and the incredible improvement that happens in people's lives when we change the dynamic in our industry.